So I want to go through one of the scenarios that I had with a former patient of mine, especially when I was an outpatient physician, ambulatory doctor, and regards to what we say when we're talking about how important it is to get diagnosed early. So typical male comes in my office, usually has to be dragged in by one of his family members. It's not out of the ordinary. It don't even surprise me anymore, because that's how a lot of men who used to end up in my office, that's how they ended up. Like someone was bringing them in, or they were waiting in the waiting room to say, hey, if you don't tell them everything, I'm coming back in to finish your story. Yeah, now trust me, my wife does the same thing with me, and I tell my doctors everything. So just so you have some full disclosure on how this typically goes down. So I'm taking care of this gentleman. Typical story, hasn't seen a doctor in years because he's been healthy. And I'm like, all right, cool. Any medications? No, doc, because I'm healthy. Now this is I'm already concerned. Not that I think something's wrong, but whenever I see someone who's avoided the healthcare system for like 5 to 10 years tell me everything is good, I'm like, please don't let me find something. Because guess what? It's a lose-lose situation for me. If I find out that everything is good, he's going to be like, you see, I told you I didn't need to see a doctor, and I may not see this guy for another 10 years, right? If I do find stuff, which most of the time I do, all of a sudden he says, see, this is not why I did not want to come to the doctor, because they're always looking for something and they always find something, right? Like it's some nefarious plot that we have when we're taking care of our new patients. So I do my typical conversation, history, physical. I tell them what labs we're about to get. I tell you, hey, because of your age, you're past due, let's go ahead. And obviously we're going to check your diabetes, cholesterol, but let's check your prostate. Let's just make sure everything's going good. He said, doc, no finger up the butt. I'm like, cool, I'm not doing no finger up the butt. You have nothing to worry about. I ain't doing it. You got nothing to worry about. A couple weeks later, lab work comes back. I got to call him. And it's one of those calls where, hey, some of your lab work is abnormal. I need you to come see me. So he comes see me reluctantly, but he comes see me because I tell the wife, and the wife makes sure he comes sees me. And I'm just kind of going through the motions, saying, hey, your cholesterol is kind of high, but it's not bad. You know what? You're borderline diabetic, not terrible. The one I was biggest concerned about is that his PSA was almost 20. Now, normal PSA is from 0 to 4, just to give you guys an idea. So 5 times the limit of what normal is. Now, before, when I saw him a couple weeks ago, he had no symptoms. There were no concerns. But now when I hyper focus on, hey, your prostate exam test is 5 times its normal limit, are you sure you're having no issues? All of a sudden, he's like, hey, you know what, doc? Sometimes I do have difficulty when I'm urinating. Sometimes the stream is a little bit difficult. Sometimes it starts and stops. And I did see blood every now and then, but I didn't think nothing of it. Like this is the typical story. It's not out of the ordinary. I don't want you to think that this is some, out the pocket. No, this is a lot of times how people who deal with those in the primary care setting, or sometimes the first time seeing this hospital, this is the history we typically take. So, of course, I say, hey, you know what? Based off these findings, based off your history, I got to go do some more additional testing, and I got to send you to some people. Right now, I got to send you to the urologist, because now I'm concerned. Like, hey, what is it that has it that your PSA is so high, right? And you got some of these symptoms. So after subsequent battery of tests, one of the tests I typically like to do is I'll just do an x-ray of the lower back, because he did complain about some back pain, but he thought it was just from work. And lo and behold, unfortunately, there is, evidence of the prostate cancer spread to the bone, right? And then, of course, when I get confirmation from our urology team, hey, this is what it is. This is what we have to do. All of a sudden, by the time this person who was quote unquote healthy and had no medical issues, I'm telling him he's got like stage 3 prostate cancer. And these are your treatment options. And they're not that many, but these are some of your treatment options. So, of course, they're terrified. The family's terrified. But again, they were with the right people. So we got the regimen started where we needed to start. But this is what I talk about when I mention this aspect of disparity. This is a person who, if I screen him maybe 5 to 10 years earlier when he was supposed to be screened, I'm not talking about advanced stage, probably, especially with bone, probably stage 4. I'm not talking about advanced stage cancer with a mortality rate that's, not 100%, right? Like it's a possibility that you can die, right? I'm not talking about that. But the reason why I had to talk about that is because it's caught late. So this is why we scream from the rooftops, trying to break down the myths, trying to break down all of the common misperceptions, and more importantly, just getting screened, because we know that if I could caught this earlier, if I could have caught it earlier, right, I'm having a totally different conversation with this guy and his wife. I'm having a totally different conversation. And unfortunately, over the years, I did find out that he ultimately would pass away from the prostate cancer. But this is, and unfortunately, again, so imagine, right, the doctor he sees after 10 years is the one who starts the process that unfortunately, takes his life. So that is why I will continue to scream from the rooftop, where whatever time of the month it is, whether it's Prostate Cancer Awareness Month or it's not, or we have a famous person die from prostate cancer, I'm going to scream from the rooftop, get checked, get checked, get checked. Like that, you got to do it.